Heart disease is the #1 killer of men and women in the United States, and our heart health is something that is always top of mind. Our 9 Health expert, Dr. Paul Coley, explains why heart health is even more important during the COVID-19 pandemic.
Heart disease remains the #1 killer of men and women here in the United States and worldwide. And there's a few different factors to think about on your blood chemistry when you're determining your heart health. So the first is your cholesterol level. Now, cholesterol is directly related to heart health. In fact, for every 40 points that you drop your bad cholesterol, which is your LDL, you actually lower your risk of a major heart attack, stroke, or other bad outcome by 22%. The next thing to think about when it comes to heart health is a parameter of inflammation called high sensitivity C-reactive protein. Now, this is a protein that exists in your blood that really tells us about levels of inflammation. So it can go up during times of infection, or if you're not well for some other reason, or have any other inflammatory process occurring like rheumatoid arthritis or lupus. But in people who don't have those conditions, they're feeling well, they don't have an infection, the level of high sensitivity CRP actually really tells us a lot about the inflammation in your body. And what we know is that the deposition of cholesterol in your arteries is not just a function of the amount of cholesterol that's there, but also the inflammation that occurs in the wall of the artery as reflected by this marker. So there are studies that actually tell us in people who have completely normal level of cholesterol, if you check this inflammatory marker and it's elevated and you start them on a cholesterol medicine called a statin, which not just reduces the cholesterol, but also reduces this inflammatory marker, you can actually significantly decrease the risk of having a heart attack or stroke. During COVID-19, what we've learned is that people with heart disease are one of the highest risk groups for developing significant complications, whether that's hospitalization, ICU admission, or even death. So more than ever, right now is the time to really focus on your heart health and try to optimize your heart health. I think one of the most important things that you can do to take care of your heart is to really understand what the risk factors are. You need to make sure you don't smoke. If you smoke, you need to quit right away. You also need to exercise regularly, so at least 30 minutes a day for 5 days a week is what is recommended by the American Heart Association. And then you really need to maintain a healthy weight and make sure that you're eating a healthy, well-balanced diet, limiting your intake of trans fats and saturated fats, and really trying to focus on a more fruit and vegetable-based diet.